dentists are always focused on health and wellness, but people are just thinking about bone, gums, and teeth. We're going well beyond that, and with the advent of salivary testing, and the costs have become very reasonable. Salivary testing very simply is a rinse and spit test. You rinse for 30 seconds, spit in a test tube, and within about a week, week and a half, we can have a bacterial profile of the bacteria in your mouth. And what we're testing for are two different types of bacteria, what we call periodontal pathogens. Those would be the bad bacteria that create inflammation and bone loss and things that nobody wants. And it's really based on if we see inflammation and bleeding in somebody's mouth. And so we do this before we treat people, and then afterwards we'll do a post-operative follow-up test, and now we have a metric to measure and show the patients. And for patients, being able to look at a kind of a bar graph from the worst ones to ones that are not really contributing to ill health, after you show them those are greatly reduced, that usually 100% correlates to what we see in the mouth. Now they're healthy, they're not bleeding. We're dentists, so it's really about bone, gums, and teeth, right? The oral cavity. But we know now that bleeding in the mouth and inflammation contributes to general inflammation in the body. 57 different diseases are driven by inflammation. And of course, the big ones for all of us is cardiovascular disease and stroke risk. None of us want to have any of those things. Those are the big ones, but it goes into all sorts of other inflammatory diseases. For diabetics, if your mouth is not healthy, you have high level of periodontal pathogens, your glycemic control is going to be much harder. So for us, salivary testing is just a way for us to treat people better with their oral health and actually get them involved in their own treatment and show them things that were never available before. So for us, it's super exciting. People respond extremely well when they can see real evidence of actual bacteria in their mouth that have lots of proven studies in correlation with what they do and what problems they cause. You're highly motivated to change that. For us, it's just been a way that we've been able to help people achieve better health.